Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. Going to show you how to scan the anterior ankle joint. So the patient position is supine. Very important to make sure you have the heel hanging off the end of the exam table. The landmark is going to be the distal tibia, and you get that in focus on one side of the screen. You also want to make sure the tibialis anterior tendon is at the top of your screen. And we know that tendon goes from a little bit lateral and curves a little bit medial, so there's a touch of an angulation of the probe. The movements are going to be sliding medial off the tibialis anterior, back onto it, and lateral, and then back onto it, just to make sure you have identified and appreciated the full width of that tibialis anterior. There's also going to be some slight angulations of the probe to make sure that you get both the tibia and the talus nice and bright. The area of interest is going to be the sulcus between the tibia and the talus, where there's some intrasynovial fat. Going to show you how to scan and inject the ankle joint. For this, I'll usually have our patients supine with the heel hanging off the table. This opens up the ankle joint. The landmark is going to be the tibialis anterior tendon. I now have that in the view on the top of the screen. The orientation of the probe is long on the tibia, slightly obliquely actually. The ankle joint is where the tibia stops and the talus begins. We'll usually place the center line over the articular cartilage of the talus, keeping that tibialis anterior tendon nice and bright on the top of the screen. We can then place the needle tip medial to the tibialis anterior tendon, going straight down and touching the articular cartilage of the talus gently. That's how I scan and inject the anterior ankle joint.